Well, the drugs manufacturer GlaxoSmithKline says around 15,000 Australians take Avandia, so should the drug be banned here? Dr. Greg Fulcher is the Director of the Department of Diabetes at Sydney's Royal North Shore Hospital.
I think that the TGA in Australia has got access to the same information that the European agency and the FDA has. No doubt it will be considering, I think, their decision very closely. I would be surprised if they come up with a completely different decision, but they have had access to this information for some time and haven't gone down this path. So it will be interesting to see what they do.
Heart attacks, strokes, these are very serious risks. Should patients be concerned?
Look, I think patients have to be concerned. Obviously, these leading agencies are concerned or they wouldn't have taken these steps. I think if patients are still continuing to take Avandia and they haven't had the discussion with their general practitioner around the issues that have been raised, they certainly need to do that. There is an alternative drug available in Australia. The committee advising the FDA found that there was a difference between these two compounds, and therefore I think patients on Avandia need to discuss either with their GP or with their diabetologist, is there any specific reason why they need to continue on this drug rather than switching to an alternative preparation which is available on the PBS.
In your view, are the warnings on the label adequate?
I think that there are warnings on the labels, but I think that, quite often the warnings may not be fully explained to the patient. And I think it's very important that not only are there warnings on drug labels, but the discussions have to take place so that patients realise that such warnings exist. So again, I think the important issue is discussion, fully informed decisions being taken by the patient, and then they can be very comfortable that they're taking medication. They understand the benefits and they also understand the risks.
Dr. Greg Fulcher in Sydney, thank you.
Thank you very much.
And following those concerns in Europe and the US, Australia's Therapeutic Goods Administration has announced that there will be an immediate re-evaluation of the diabetes drug Avandia.